All right. So if you are a pelvic floor PT or you're a mom and you've dealt with pelvic floor overactivity before, my next guest will not be new to you. And if you know what this is, and if you know what this is, she will not be new to you either. So I'm so excited to bring Amanda Olson on the show. She's the president and chief clinical officer of Intimate Rose, one of our personal favorites here in the clinic. Thanks for coming on the show, Amanda.
Thank you so much for having me.
So you, I think in our field, you're a little bit of little royalty, yeah. Like you're one of our favorites again. So, but you've been a PT for how long?
Um, 14 years.
14 years.
15 years. I think I just had my 15th anniversary of being a physical therapist.
I might have just had my 25th. I don't know.
Oh,
Shh, don't tell anybody. But also a mom of two. We have 9 and 6.
yes,
Yes.
yes.
So been there, done that with the postpartum thing, and then also a runner.
Yeah.
And then if I recall, you've got like gymnastics bendy history as well. So I totally feel like you should start CrossFit now. But
I probably need it.
maybe. Oh my gosh. So like how did you get, first of all, let's do the business side first. Like how did you start as a PT and be like, hey, I want to create devices for PTs and for women. And now it's really for everybody, quite
Yeah.
honestly.
Yeah, we love all the people. We treat all the people. As a pelvic health provider, I just wanted to make something one that was like ultimately extremely comfortable and easy to use, and two that was really bright and cheerful and like provoking of hope and empowering. And so I went about working with my business partner, and we have a silicone that has a really unique finish. So I just wanted it to be really soft and smooth and easy because it's going in sensitive tissue in a sensitive area. And then I got to use my creative side and work with color. And there's like color theory about how different colors evoke different kinds of feelings. So I just wanted them to be like really bright and cheerful, even for men or trans people, like all of the colors are meant to just be really fun.
Yes. Well, and we were talking before we came on about like back in the day, and I think it was probably when you started too, like we looking for devices for, and at the time it was mostly we're like, okay, for pelvic pain or things like that. And we'll talk in a second about how we work with athletes with these things. Um, it was you were kind of buying stuff from a sex shop, to be honest. And I very distinctly remember like some of the very first like plain white dilators that we used to use. I remember trying to get one to bend in the right spot. And I literally remember with tongs and boiling water trying to get it to bend at the right spot to get it the curve that I needed for my finger. Apparently the chemical makeup and the physics or whatever didn't work out. So I'm glad you figured it out. But it just like, I mean, we didn't have a lot to choose from back then, and
Yeah.
we really were only using it with patients with pelvic pain because it was only patients with pelvic pain that had overactivity, right? Like, do you remember what that was like?
Yep, I do. It was the camp of overactivity versus underactivity.
Yep. And if you
Yep.
were pregnant postpartum, it was only you could only be underactive. You could
Yes.
only be doing Kegels. There's no way on this earth that you could have overactive muscles that couldn't possibly be related to leakage or prolapse or anything like that. And then things changed.
Right.
I was saying before we hopped on, I just had a session earlier this week. It was so fun with a mom that's having overactivity, and so we're dealing with some pain issues. So she's got her dilator program and her one program that she's working on, and then we immediately go to work on like some kettlebell and some loaded work and getting her ready for return to workouts and things like that. And like that was almost unheard of. Like when do you remember kind of that change starting to shift a little bit?
I would say last 5 years has been
Yeah.
like the hard left turn out
Yep.
of this paradigm land. Um, that I feel like that's when like there was that big hard shift, and that changed my thought paradigm and how I was looking at the person in front of me. And
Yep.
the wand came along 4 years ago now. So
That's it?
Yeah,
Oh
yeah,
my
vaginal
gosh, really?
weights.
I feel like it's always been here.
I know, I do too. I do too. It's been the vaginal weights came along 7 years ago,
Mhm.
and then the dilators were roughly 5, and then the wand 4, and now we have 4 different kinds of wands.
Oh my gosh, time has no meaning anymore, I've
No,
decided.
no.
It really doesn't. But it's one of those things I think, before with, like, painful sex, we're like, "All right, use the wand, do some down training, that kinda stuff." But now, I mean, myself, and I tell clients this too, like, I had hip surgery 16 years ago. I do have some overactivity, obturator and turnus, it's a hip rotator on that side, and there's a very particular pain that I know when I feel that, there's no other way to get at it, and that's what relieves it, and it's like 2, 3 minutes, and I'm good to go. And I don't know that I ever would have thought before, like, "Oh, yeah, this is just like, my lacrosse ball that I do my mobility with for my back that everybody's really comfortable with, or their foam roller," or like, everybody's fine. I don't think I'd whip this out in the gym, but although no one would put it past me, right? Like, I don't know. Maybe that's a gym in the future, I don't know.
Pretty sure the ancient Greeks would have.
Yeah, maybe. So for you as a mom and being very active, runner, gymnast, that sort of thing, like thinking back on your kind of pregnancy and postpartum experience, like what do you remember kind of going through, and in the rear view, what do you wish had kind of been a little bit different?
Mm. I had 2 very different pregnancies, so going into both, I was in marathon shape as a runner, and working full time as a physical therapist with both, and I remember with the first one, you're new and you're wanting to be respectful of your health and your safety and your baby's safety. And I remember as a pelvic health PT, I was already a pelvic health PT. I already knew all the warning signs and I was looking for those and looking to stay comfortable and run as long as I could. And I remember, like, from a psychosocial paradigm, I remember judgment, because I was
Yeah.
still racing half marathon until like halfway through. I'd say I did like an 18 miler when I was like 5 months pregnant, and then I
Mhm.
tapered down. But I was following my physician's orders and I was listening to my body, and I was cross training a ton, staying really strong and really mobile. And I remember having to like explain myself, and I was still young enough to think that I
Mm.
should explain myself. I don't think that anymore. I'm almost 40. I've got
Right?
very, I've got a very
When
sassy.
when you get closer to 50, there's less Fs to give, just trust me on
Yes,
that
I'm
one.
all
So
out. I am all out now.
oh, yeah.
But I remember, like, really working on the whole picture as a physical person, and also I remember that strain. And then in the postpartum period, I remember being in a hurry to get back,
Yeah.
and I'd had thankfully a very healthy pregnancy and a pretty smooth delivery, and I was right for it, and I was racing half marathon at the 5 month mark. And then with my second one, and I always like to point this out for people so that they can understand that there's no, even in one person, there's no two pregnancies that are exactly alike
No.
that are going to lead to fitting into some box. Because with my second kiddo, I was not permitted to do any exercise at all. I had
Mm.
a placenta issue. He's fine. He's great. But it was a pretty scary pregnancy. And so I was not permitted to go for a walk or do yoga or anything, like no physical
Oh,
activity.
wow.
And then, thankfully everything was okay, but had a pretty eventful delivery with injury to the pelvic floor and those kinds of things. And so there was a lot more work that had to be done there. And it took a lot longer. And I remember feeling like, even understanding as a pelvic health provider,
Yes.
feeling that frustration, and still feeling like I was in a hurry, but I at least knew what to expect and I knew what was normal. And it made me appreciate for people who don't,
Yep.
how unnerving that is, and how nervous, having had that scarier pregnancy and having had that more eventful delivery, how disarming and disorienting that can feel when you have a goal. And I say, like, I raced half marathon about a year later, and that's
Okay.
still pretty
I was
quick
gonna say that's pretty
considering.
decent. If to go back to your first pregnancy, you said there was a lot of judgment. Was
Yeah.
that from fellow runners? Was that from our profession? Like, where were you getting that from?
Family,
Mm.
friends. My running friends were cool. Like,
Okay.
I think I mean, they had enough respect for me as a professional. So I had buddies that I was running with that,
Mhm.
like, when I had to slow down or I had to walk and I was out of breath, they were like amazing, and I'm so thankful. And that's your running group, you know.
Yeah.
But definitely it was family. I think. You know, of our generation above us, I'm not going to specifically call out certain parents, but
Sorry, mom and dad.
the generation above us, you know, they just first of all, they were pre-Title IX, so they weren't athletes like we were, and
Right.
I very thankful to have grown up as an athlete, not just in gymnastics, but in other sports too. And so, you know, that population of women had a different expectation of their body to begin with, and
Mhm.
certainly had different recommendations from physicians
Right.
and different expectations. So I know that there was a lot of people, older adults in my life that were not that had some things to say about me and my body.
Oh, wow. So at that point, did that even as a professional, even knowing you're like, "I'm okay in my body," did it still make you second guess? Because 'Cause you're like, "This is the first time I've done this before. Do they know something I don't?"
Absolutely, and I would cross check with my physician. I mean, I absolutely second guess myself
Yeah.
at that stage. So I was checking with my physician and other providers too, like getting multiple opinions, and everyone was like, going back to the ACOG standards, which with my big guy 9 years ago, they're totally different now.
I know.
They
I
you
know.
know, there was different things. So I was running with the heart rate monitor. I was running with, just other factors about
Yep.
temperature and outside and those kinds of things. And we always just brought it back to the data and what we knew back then. And, you know, certainly what we know now is different. We use the talk test to measure exertion
Right.
and looking just for the red flags. And once I like grew into that, it was fine. And I think that if that's the gold standard now too, is let's go back to the guidelines. Let's go back to your individual pregnancy
Yep.
and your delivery experience.
Yeah, exactly. And so going on to that first postpartum, I mean, obviously 9 years ago, and I have a 9-year-old as well, like, there really still wasn't anything to help us. Like, what do you remember kind of figuring out for yourself, like, "All right, this is how I'm gonna start back?"
Mm. Yeah, I think I was just like, put the shoes on and I'm gonna run until I can't run, and then I'm gonna walk until my heart rate goes back down, and then I'm gonna run again. I think it was just a little run walk. It was kind of
Yep,
like injury,
yep,
you know. And I think most runners, if you've been running a long time, you understand injury, whether it was your IT band or your hip or whatever. And so you
yep,
know that first run it might go a lot of different ways. And so I just remember like aiming for roughly 2, 3 miles, understanding that I was going to stop and walk.
yeah,
And I think that that's a helpful bubble is like, all right, let's pick your favorite loop that's close by to your house.
yep.
Understand that you're going to listen to your heart, you're going to listen to your pelvis and your body. And when it tells you to walk, you're going to walk.
Yeah, no, and that's the thing, and just as a reminder for people, like, I have moms that, they're finally getting in, they have a 5-year-old, and they're like, "Gosh, why didn't I know these things?" I'm like, "Because we didn't have delineated guidelines yet," and people they don't believe me when I'm like, "No, no, no, there really wasn't anything," and for you to kind of go along, it's kinda like having an injury. I think that's such a great kind of connection, but where I end up in trouble with clients is if they never got injured before, then they
Yeah.
really have no idea what I'm talking about. If they've been injured, they totally got it, and they're like, "Oh, yeah, of course," especially if they had, like, knee surgery or something like that, they got it. If they've never been injured, it's really hard because they're like, "Well," I mean, I had a client yesterday, and she's just like, "Well, I don't understand what happened." I'm like, "Well, you had a baby. We have a little bit different body 9 months later. Some things happen. We just need to build that back." And she's, "But I was strong." I'm like, "Yes, but it's a different kind of strong."
Yes. Yes, and I like to liken it, and so I don't know how this lands on everyone, but it's almost like Alice in Wonderland, where like
Ooh,
one minute you're this size and
yep,
you've grown to accommodate a whole human being, and then
yes,
literally the next day you're a totally different anatomical being.
yes,
And it is that fast, almost like in Alice in Wonderland, where she eats the
yeah,
cookie and she's suddenly smaller or larger. And so
that's a good
your brain
analogy.
map, yeah, and then your brain map has not yet accommodated for those changes in anatomy. When you're pregnant, it was a day by day steady growth, but
Yep,
suddenly in your postpartum, your brain map isn't really quite the same as it was, and we're just going to introduce your brain map to
Yes.
your body.
I love that brain conversation because I think we all kind of forget that that's part of it. I mean, that's I feel like first time running for some moms, I've got a little path out here and I'll do that first one with them because the first time is you kind of feel like a baby giraffe.
Yeah.
Like you're just like you're like, you know, like parts are everywhere. And I it's confusing, like, I remember feeling really hollow, like, that was strange, like, I see it the same with my CrossFit athletes too, that, like, the first time they go to do, like, a clean or something like that, and they do a pull and, like, they're going around a non-existent belly. I'm like, "No, no, no,
Yeah.
that's not there anymore." Like, in their brain, I was like, "You don't understand. Your brain thinks you're here and you're totally not. Like, you're just not." So I love that you kinda highlight that the brain's got a little relearning to do too. So,
Yes.
definitely. Now, second pregnancy, things are different. You've got kind of a serious medical issue. Did that kinda make it almost easier mentally for you to be like, "All right, it's okay that I'm not doing that much because I have a really good reason for it?"
Yeah, I do think that that framework, like, gave me grace,
Mhm.
and I knew to change my expectations, and I would say, like, I was just, like I liken it to, like, at that point, my running was in service of me and my life rather than
Mm.
me being in service of my running, so my running is special to me, and it's my time with myself, and it makes me feel so good,
Yep.
so I knew, like, whatever I was able to do was for me rather than, like, pushing a race date and training for that running.
Yeah.
So I had to like it was just a change. Whether like I was on a strict training program before and I was in service of my running. Now my running was just in service of me.
Gotcha, and in between there, before you got pregnant the second time, did you run with the jog stroller and do that whole thing too? How did that work out for you?
It was great. I really loved it. It was such special. I live in a very hilly part. I'm in Oregon and I literally live on a little mountain.
Mhm.
And I love that stuff. But it was special time. I really savored that time with
Yeah.
my baby, with my little buddy. And I will say, like, when I was in that newer postpartum phase, I would say like months 3, 4, and 5, I would run with a group who were happy to take over that stroller for me. So
That's nice.
again, it was like that safety bubble. So it's like
Yep.
if I got fatigued out, they would take the stroller and I would just be me
Yeah.
running. But I loved it. And
There
certainly on the longer runs, just getting out by yourself.
Yep. No, I live in Arlington, Virginia, so at the time we were very close to the Potomac, and I just had to kinda get down off the hill a little bit, so there's great flat trails, so it's great for getting back. The problem being that, and you know this too, there's a certain age with children that which, A, they will throw things out of the stroller, and then B, they will demand that you get them out, and then they will not go back in because 'cause they'll do like the Spider-Man arch thing, like, "Ah," and they will refuse to go back in, and they summon superhuman powers, which is
Yes.
really not cool when it's, like, getting dark and you still have, like, 4 miles to go back, and
Yes.
so I'm pretty sure that was, like, the last day for me. I mean, that's one of the ones that's, like, burned into my soul where I'm like, No, we're not doing this anymore."
100%, and it's
Mhm.
child dependent,
Mhm.
yes.
Yeah. Yeah, I'm trying to think with my second if we did that much. She kinda just went everywhere for everything, and so we had the big double bob, which is a freaking
Oh,
bus, which is,
yes.
like, great to take to festivals because you can off-road, you can do all this stuff, but, like, between the big stroller when she was little in the carrier, and then he was, like, probably 30 some odd pounds, she was, 15, like, that's a tank!
Oh, yeah.
It is a tank. I think I did one, like, 5K for preschool with it, and I was like, "Nope, otherwise we're just walking with this thing." It's like, I'm pushing 150 pounds.
It's so true, and you think about what a different mechanic that is, pushing through the shoulder and
Oh my
controlling that
god.
wide thing with the double bob. I had a single bob, and by the time my second kiddo came along, first one wasn't having it, so I only ever
Oh,
had the single.
okay.
Do love that bob, but yeah, it's a lot, and it's a lot through the shoulder girdle, which
Yes.
oftentimes has changed with pregnancy and nursing and
Well, and going down a hill, you're taking your life in your hands, like, because you're just like, all right, it's going without me. And you're like, where's the brake? You got that. They used to have this that's like leash that was attached to
The
you, like
leash.
pull in case of emergencies. I'm like, we're already there.
I would always have it, like, wrapped up and
Hmm.
double wrapped and then secured too, and then it's eccentric quads all the
Right?
way
Oh my
down.
god. Yeah, no, 100%, 100%. So, last year you were an author on the rehabilitation of the postpartum runner four-phase approach. That was in the journal Women's Health PT last year. Congrats on that. Like, when you were pulling that together with the group, and we've had Shefali on and some of the other authors as well, like, did it kinda make you take pause looking back at what you'd done as a mom and you're like, "Oh, it's a little different now."
1,000,000%. I mean, it was like, my goodness, just seeing it laid out after all the work that we had put into every single segment. I'm
Yeah.
like, well, I did my feet, no service, did I? And I wrote
I
the foot portion.
know. Oh my gosh.
But hindsight is always 2020. And but yeah, I mean, pulling together, looking at the evidence, that is the kicker. And I hope that when people read that article from a clinical perspective, I know we have both athletes and moms and clinicians here. So
Yep,
when you look at it from a clinical perspective, every single exercise that we gave is evidence based.
right.
So there's a reason. It wasn't just our favorite ones. It wasn't just the ones that feel good on our body or that our patients liked. It was ones that there's evidence behind, and there was a lot of thought behind what needs to take place in each phase in order for that person to have a smooth transition and a safe and conservative transition back into running so that we can ensure that they are truly ready.
Yep. And I think that's a really good point to bring up because our field, I remember when I first started, they're like the art and science of physical therapy. I'm like, what the hell does that mean? Right. Well, what it means is there's a lot we don't know. Here's what we
Yeah,
do know. You might be doing something a little bit different in clinic for that person in front of you, and that's okay.
yeah,
And that's why I think it's so important to kind of a lot of this baseline work that's being done right now in postpartum return to run, it has to be done. It has to pull what's out there, what we know, so that we have a platform to move off from. And that's why, I mean, if we go back to, the UK guidelines from 2019, like how much, they all had to look at.
yeah,
And I love that just since then, like everything is continuing to build upon that. And we're pulling what we know and I have to imagine in, 4 or 5 years, it's gonna be completely different and more evolved and more specific, and we're gonna have pathways, and if they're like this and more like algorithm sorts of things than
yeah,
what we have now. But I know some people are like, "Oh, well, this is the evidence. This is what we have to do every time." I'm like, "Well, we use evidence informed,
yeah,
and it's good to have evidence to inform us, but we still are working with that person in front of us. But without that evidence, you're just like throwing crap in the air, I suppose."
yeah. Yeah, and then it leaves a lot of variability to why a runner may not meet their goals with
Yeah,
one provider versus another because we're looking at it differently or through a
yeah,
different lens. Yeah.
yeah. Well, and especially, I mean, did you go straight into pelvic health out of PT
I
school, or you did
did
other
1
stuff?
year of peds.
Okay. Oh, wow. That's okay. You took a hard turn.
Very hard turn.
Um, no, and that's I'm sure you see this now. Like, there's a lot of people that are in pelvic PT that they go straight to it.
Yeah,
So you kind of relate to this a little bit, but I mean, at least you had some background in sport and that kind of thing. But when people go straight into that, like they're not as informed,
yeah,
about running and training and that kind of stuff. And that's really where I really appreciate that we've got, this other information being pulled in because they might not have a great, you know, conditioning background or exercise background or things like that. It's like it's good to have a place to start from if you don't have that information. So for you kind of after you guys finish that, like I'm sure there's a million and one things swirling around. We're like, okay, this is what we do next. Like what are kind of the next big gaps in your mind that need to be kind of looked at as far as postpartum return to run?
I think that a lot of different labs are looking at correlation of kinematics, so how the runner is actually running and what exercises need to be in place in service of the actual run itself.
Hmm.
Because that data is hard to get. It's hard
Yeah.
to do comparing cohorts in a either pre-pregnancy to postpartum phase, or getting those postpartum subjects back into lab. So I think that there's a lot of room for study there, and I know that they are working. Shefali and Rita and
Yeah.
Brian Heiderscheit and all these different labs are really trying, and our international colleagues as
Yep.
well. We do have a couple more papers coming out. They have just been submitted, but we did a Delphi study where we
Oh,
were
yeah.
pulling. You, I'm sure, were involved. We were blinded. We
Mhm.
don't know, but where
I won't
we
say.
we we drew in experts from all over the world. So there's like 9 of us from all over the world, and we're drawing in, and we are looking at not only what the participants as clinicians said, but then we're also pulling together our own recommendations on top of that to fill in a lot of those gaps regarding nursing status, regarding fatigue,
Yep.
regarding pessaries and things like that. So
Yeah.
we're hoping to fill a little bit more of that knowledge gap in
That's
terms of
awesome.
progression with those.
Gotcha. All right. Well, I'm going to go full circle here because I have some research ideas that involve this and running.
Yes, let's hear it.
No, so because obviously you have a vested interest in that. I mean, like
Yeah,
I feel like the past, kind of like you said, the last 5 years or so, we've really paid more attention to overactivity in our athletes, in our postpartum athletes, and I think stress incontinence. I feel like in our field, I feel like kind of everybody gets it now. Like stress incontinence, yeah, there can definitely be an overactivity component. I feel like the last maybe 3.5 years, I've been starting to think the same about certain types of prolapse symptoms.
yeah,
And obviously, again, I work with CrossFit athletes and runners and that sort of thing. So it can come up and it can be very detrimental to have that feeling doing those sports. And one of the things I see a lot is women that they feel like that tampon dangling feeling, or they feel like something's there constantly. Their OB looks, and they might even look in standing, and they're like, no, we don't see anything. And so then mom walks away feeling like she's completely crazy. And the fact of the matter is, I dare say more than 90% of the time, there's some degree of overactivity, hypertone, whatever you want to call it. Like there's more sensitivity there. And it really made me reach back to working with chronic pelvic pain, and that like, upregulated sensitivity, that kind of stuff. Like playing with that has been super fun because we're not changing the position, which I think we've got to kind of get over that anyway, but we're changing the symptoms. And I'm like,
yeah.
why did we not think of this before? Like, has anybody kind of brought that up to you as far as like, hey, this is another possible use? Yes, it's overactivity, but like in pelvic organ prolapse symptoms.
Yes, absolutely. I've had a lot of colleagues reach out and say that they are using the wand to help manage the fascial connection to the
Hmm.
muscles and the sensitivity. And specifically along those lines, working with turquoise and blue wands are the same, they are vibration wands.
Yes. Yep.
The vibrating wands have 10 frequencies. Some are very low, some are medium, and some are high. And so, in that way, the patient and the provider together can be working together to choose a vibration frequency to be doing some fascial release, and also just work on even like release and then activation, deactivation,
Yep.
activation, deactivation. That can help with the sensitization training. It can also help with that retraining of the cortical map and induce some neuroplasticity
Yeah.
that can be helpful in what feels like the position, right?
Yeah.
Like you touched on it, and that's the reason why we can have a patient with like a grade 2, grade 3 that has no idea. They're
Right.
asymptomatic, they don't sense it at all, and we assess and we're like, "Oh, by the way, I do see some change in
Yeah.
organ position here." And then we have some that are grade 2 and it's highly symptomatic,
Yep.
extremely bothersome, and 100% they're right. It's not that they're overreacting or anything, but
Yep.
their nervous system and their sensory system is picking it up, and it's giving that feedback
Yep.
a lot.
Yeah, I mean, I feel like that's been such a game changer in how I've thought about working with props. And because you'd have those patients and you're like, I don't see anything, and it would kind of freak them out, right?
Yeah.
But to say to them, look, your brain's doing this. We've got to figure out why it thinks it's so awesome, because you and I both know that it's not. But I think that the best explanation using the wand for me has been this is just input. Like
Yeah.
we need to give your brain an alternative to start to look for different options. But again, I don't know that I would ever have looked at it in that view without having worked so long with chronic pelvic pain where, we're talking, we graded motor imagery and all that kind of stuff. But it's just so cool that we're able to kind of extrapolate and pull over coming from a place where it was like, okay, if you got leakage or prolapse, you're doing Kegels or nothing. Like, it's so cool to be in a field where you're like, okay, in my entire career, I completely do things differently, even just within a couple of years.
Yeah.
It's so fun. And then also to have really not scary things
Mm.
to give people because it's not scary. Like
Mhm.
one of my clients, she's like, oh, I don't have it when it's the darker blue one. She calls him Cookie Monster.
This one she calls Cookie
Oh,
Monster?
no, the Dilators.
Oh, the
The Dilators
dilators.
Cookie
Oh!
Monster, and the green one she calls Kermit. So we and
That's Cookie Monster.
Cookie Monster. And I was like, there's people online that, to keep from getting, blocked, they'll put like googly eyes on them and things like that. Like I've seen that so people don't get, banned on social media. And I was like, Cookie and Kermit. I'm like, whatever it makes you like you gotta have a sense of humor about the
I
whole
love it,
thing.
absolutely. A spoonful of sugar helps the dilator go in.
Right? Exactly. Oh my goodness. So again, it doesn't have to be like pain with sex to have overactivity. It can kind of be these other things. And I know talking about that just gets people thinking like, okay, well, I thought maybe there wasn't anything I could do because I did do the Kegels and it didn't help. Hey, there might be this other thing. And again, to have clinicians that maybe still think that, oh, I'm only going to use this if they have pain with sex, be like, no, we might be able to consider it with other things, which is the more we can kind of think about how we use the tools that we already have and leverage what we already know, I think it's so good. But yeah, no, it's been a game changer and it's just so nice to not have to like buy stuff from sex websites. So thanks for that.
My pleasure, my pleasure. My sentiment is, and this guides like my practice and my business, is that there's a classy way to do anything. And whether
Yes.
it is a tool for sex or a tool to get back to running, there's just a classy way to do anything. And that's
Yeah.
what I aim for.
Totally, totally. I like that. All right. So everybody that comes on the show, we have questions for you. And I did
Okay.
not give these to you ahead of time, so there's no pressure. Um, Favorite activity since becoming a mom, and it doesn't have to be with your kids.
Oh my gosh. Okay.
I always have to caveat that when I'm like, it doesn't have to be with your kids.
My favorite activity being alone are going for long walks in addition to my runs and reading. And then with my kids, it's evolved as they've grown older, but I loved playing little cars. Like I'm a boy mom, I have 2 boys and
Mm,
until they tell me otherwise, like
yep,
they are loving dinosaurs and all the things. So I loved to play cars with them. And now like we can go out on the basketball court and I can
yep.
like play defense and like so that's
That's
really fun.
That's when they'll talk to you. My oldest is a boy, and so he'll talk if he's playing basketball, he'll talk if we're walking the dog, or he'll talk if we're driving somewhere and he's in the front seat with me. That's when he will talk to me. So, you at least have that going for you, so
Yes. I think there's something to, like, be the streaming and moving forward and not having, like, that direct contact where they
Mhm.
can be more honest.
And it's very strange because my 9-year-old is a girl, and she's, chatty Cathy and is an overshare, which I'm not upset about, sorry, honey. Not upset about it at all because I'm, like, putting the time in now, so later on she'll come to me.
Yes.
Yeah, definitely. And what are you reading right now?
I just finished a book. I, like, read a ton of French history. I'm very
Oh,
nerdy.
okay.
Um, but I just started, it's actually fiction, which I don't read often, but it is, a historical Proust, so it's, like, French literature.
Okay,
Um
didn't see that one coming.
I know. I spend so much time researching and reading and writing in the healthcare and running space that
Yeah,
I have just gone I do a ton
you
of,
gotta
like,
go fiction.
nonfiction. Yeah,
Yeah.
exactly.
No, I'm kind of the same, like, sometimes I get in, like, super, like, PT mode, and then sometimes I just need, like I think I'm reading what is it? The Seven Husbands of Evelyn Hugo, which is fiction, And then I'm reading Are You There, God? It's Me, Margaret with my daughter.
I read that when I was like 12. That's
I
so
know.
sweet.
I know. So she's reading it to me at night. And it's funny because any part that talks about like boys and things like that, she's like, oh my God. Like she's still like super embarrassed. And then like my son comes in, he's like, I'm out of here. But we're not to the part yet. Like, I don't know if you might, I don't know if you remember this, but like the part where they talk about like the sanitary belt, like hooking
Oh,
to the
yeah.
napkin. So like that changed like right before like my older sister like went through that. And so it's one of those things like for us, we still had pamphlets with that stuff in it, but like
Yeah.
you don't realize how important adhesive was. Like adhesive wasn't a thing. What the hell?
Yes. Like,
So
that's
I
a
was
lot
like,
of apparatus.
right? So I'm pretty sure when we get to that part, I have some explaining to do. Um, so, because at the time, even when I was a kid, I'm like, "What the hell is that?" But yes, I'll have to explain to her that there was a time when there wasn't adhesive. So,
I remember wondering, like, is this like a belt, like, where is this going? Under our clothing? Over
right?
our clothing?
I don't know, but I think it was under, but it was like a plastic belt. I remember
Yeah.
because like they sent him home with my sister, and I was like, "What is that?" So yeah, yeah, I have some translation to do. All right, next question. One piece of advice for new moms.
You know yourself and you know your child. So, getting advice from professionals or people's whose opinion you value is helpful. Do not listen to anything else.
Yep. Yep. No, I think that's so important. All right. Who is somebody in, we could say pregnancy, postpartum, we can say running, whatever. Who's somebody in kind of this space that we should know about that we might not?
All right, I've got a whole list for you. You already mentioned
Yay.
Holly Christopher. We got Rita
Yes.
Deering.
Got
We
her.
have Granye Donnelly.
Got her.
We have Lori Forner.
Got her. I want to get her, but she's too
Get her.
freaking busy. Lori,
Uh,
hey, call me.
yeah, she's finishing a PhD
I
and
know that's what
apparently living.
I've asked her twice because I started to love Lori and fangirl her when she started CrossFit and was wearing like booty shorts. And so I'm like, oh my God, I want to be Lori Forner someday. So
She is fun. She is
she-
very fun. Yeah.
whenever you're done with your PhD, Lori, call
Yes.
me.
Yes. Call Carrie. We have Izzy Moore.
Yes,
She's
she's
a great
fabulous.
researcher.
Yep.
Margie Davenport.
Yes.
Kari Bo. She's like she's
She makes me nervous. I've met her. I've met her at World Congress, and I'm a little nervous and a little intimidated.
she's so smart and she's so
She
like she's
is.
just like a library. She's like a
Yes.
library of knowledge.
I think that's what scares me a little because I totally appreciate the work that she does. I am so in the gray clinically, and
Yeah.
that's why I'm not a researcher and clinic. Like I think I would just probably make a fool out of myself talking to her, but other than saying hi, I'm Carrie. So no, I've met her and she scares me, but I appreciate her. I love
That's
her.
fair.
Like, all good. And she's like, "Who's this crazy girl?" All right. So all good ones. And we've gotten
Yes.
everybody on the show actually, except for Lori and Kari. So
Okay.
yeah.
And
So
one more is Christina
yes.
Gresta.
Ooh. Okay. Don't know that name.
Yes, she is
Okay.
faculty at UW, University of
Oh yeah.
Washington.
Awesome.
I have known Chrissy for a very long time. Chrissy is also a wealth of knowledge. She is razor sharp. She comes at the pelvic health postpartum from the orthopedic perspective.
Love it.
So she doesn't do like internal work, but she's been in the lab. She's done the kinematic studies. Like
Mm.
she's amazing. She's just
Okay. Cool.
lovely. Yeah.
Okay. Call me, girl. Um,
Yeah.
I love it. Love it. Love it. All right. Last one here. What does it mean to you to be an active mom in postpartum?
Doing what brings you joy in
Mm,
movement. And so it's like, I also do Pilates and I just love the feeling of Pilates, dancing, going for a walk, all of that. Find what brings you joy. You do not have time for things that don't bring you joy.
yes. Oh my God, yes. Enough of the should. Enough
Yeah.
of the should. I love it. All right, mic drop. Wonderful. So if you want to know more about Amanda and Intimate Rose and all the fun toys, I have all the fun stuff here. You can catch her on Instagram at Intimate Rose or at a Olson DPT. Amanda, thank you so much for joining us. So happy to have you on the show.
Thank you so much, Carrie. I always love seeing you. So this was fun.
Thanks.